We're here if you need to ask any more questions. Elections will take effect June 1st of 2024, run through May 31st, if we can say this, 2025, which is unbelievable. Deductions will come out of your paycheck effective June 14th for full year employees. Part year employees need to arrange payments for payroll during the summer if you have not already done so. Premiums will be taken out of your check pre-tax, so that is not changing, right? Because currently when you pay for your insurance, it comes out of your paycheck pre-tax, so that is not going to change at all with this insurance, and it won't change. The only time after June 1st that you can make a change is if it's a life qualifying event. And so there's marriage and divorce, a death, a birth of adoption, a change in employment status, dependence eligibility. So if somebody is 26, coming off their parents' plan, that's considered a qualifying event. Loss of significant change to your current coverage, judgment, decree, or court order. With CHR, if you come into a situation after June 1st that you think you might want to add insurance or drop insurance for a reason, and talk to HR, and there might be another reason why, so we can work through that for you. But you have to notify HR within 30 days of that qualifying event in order for us to make the changes with the carriers and to get that in effect. If you wait after, that has happened, not with this group, but it has happened, somebody has a baby and thinks they're automatically enrolled. That doesn't happen. So if it's after 60 days, if even longer, you might have to wait till open enrollment the following year. So make sure you notify HR right away. So we're going to start talking about the change that we're doing as of June 1st. As of end of May 31st at midnight, you will no longer be with UMR Insurance. Okay? So remember, as of June 1st, you're going to need to use your new insurance cards that you will be getting. And then we'll talk about claims also later. We are going to be moving to what, and I know Millie has referenced this, to reference-based pricing. And what this is that there is no network. And I know that sounds kind of scary, and this whole concept seems a little bit scary to everybody. Don't be afraid, right? We're here to help you. We've got Brian from MedBen here who's going to talk, and then we have Mike from HST who's going to talk. There's two components to this. You have your MedBen and your HST. Your MedBen processes your claims, right? So when you submit it, when a doctor submits a claim, it goes to MedBen, they process it, they do the EOBs, just like you do now. What HST does, they're a component that they work with the providers to work on acceptance, and what we do is we pay a rate of Medicare plus a percentage, right? So that's what gets paid to the providers. It's not where this insurance companies negotiate, right? They have contracts with them, and that's the contracted rate. There's sometimes these rates will be less to what we pay to the doctor. But you still have your same deductibles and your same co-insurance. None of that changes. There is just no out-of-network. So MedBen is your insurance provider. You will see their logo on the new ID card, right? So when you go to your doctor's office, you will make sure you hand them that new ID card. Pharmacy is not changing. So you don't have to worry about new prescriptions, mail orders, none of that. That's all staying the same. So that's one component of the insurance that will not change for June 1st. The reference-based pricing plan, I'm going to hand this over to Brian. I'm going to let him start talking about MedBen, what they do, what we look at, for what you'll do your next steps, right, to look up a provider. We'll talk about the hospitals, what's different on that, and then please, this is your meeting. Ask questions at any time. Do not hesitate to ask a question. If it's something that's one-on-one that you don't want to share with the group, and we ask you do not share personal information with the group, I'm more than happy to stay after and speak to anybody one-on-one. Millie also knows, Judy knows, Dan knows how to get a hold of me. So if there's also a question outside of this, I would be happy to talk to anybody.
So I want to start by saying my name is Brian Redd. I am an account manager at MedBen. I have been with MedBen for 10 years. I started in customer service for 6.5 years, with 2.5 of those years actually being the customer service supervisor. So one of the things that I can't stress enough, coming from a customer service background, is that if you have questions, concerns, please let us know. Because if we don't know, we can't help you. So any questions, I know insurance can kind of be finicky. A lot of people stress out about it, but that's what we're here for. So I know on our slides here, it's something that's a little further down, but there's a customer service phone number that is listed on your card. Like June said, there's going to be a new card. It's going to have your prescription information on it. It will have our customer service phone number. It's going to have your ID number. It's going to have information that you'll need to present to the providers. And you'll want to make sure that as of 6/1 that you make that change or show your providers. Because what they may end up and do is if you don't give them the new ID card, they may submit it to UMR. And so the claim won't process. And so just make sure that you have that new ID card. A lot of times I've actually called providers beforehand, hey, I'm getting a new, switching, insurances effective, say 6/1. Can I go in and scan it in? Or they'll just say, bring it to us on your next appointment. So with the reference-based pricing, it allows you to seek any treatment from any provider. So you don't have to worry about if the provider's in or out of network. I know Michael talked a little bit about HST in a little bit, but there is no network. And so if the providers attempt to balance bill you, please contact MedBen, which is, phone number is 800-686-8425. That will be on the ID card. If you get a balance bill, and we'll talk about that for here in a second. And what that is anything more than your deductible or your co-insurance. And so, and if you're having trouble determining that, just call MedBen. And so here, this is kind of like a sample of our explanation of benefits, what it looks like. So on the upper right-hand side is going to be our MedBen claim number, then the pay date. It'll have your information. And then here, patient summary, the total amount billed, and then the excluded amount. So the excluded amount is kind of is a discount. And so then the allowed amount, and then what your responsibility is here. So patient responsibility is what you want to pay attention to, because that's what you owe. But MedBen is not who you pay it to. You will pay your provider. So on the explanation of benefits, it's not on this, right here. This is not a bill. So when you see this, you don't pay MedBen, you'll pay your provider. So you'll take this explanation of benefits and match it up with the bill that you have. And so down here, it'll say, like, here's the excluded amount here, that'll match up. And so if this amount does not match your bill, give us a call. Give us a call at MedBen, and we can walk you through it. And then, if they are balance billing you, that's where HST will step in, and we'll talk more about that. And then, like I said, when most plans, hospitals set their own prices. Some charge a lot more. And so reference-based is a way to be transparent. It's a result in a lower price. And then reference-based changes, our charges are paid for medical providers and services. So it decreases your out-of-pocket cost, and then also it saves money for the plan for years to come on that. And then one of the greatest things that we have for MedBen is a mobile app. I actually use it every day for me personally. But it's a great way to see your accumulations, what you've met towards your deductible, your out-of-pocket. You can also get on there to view any claims that come in. You can get an ID card. We have a digital ID card that'll be on there. Also, you can pull up the explanation of benefits with that. It's password protected. If anyone is over the age of 18, they have to create an account. So if you have a spouse or a dependent that is over the age of 18, you'll want to make sure they create an account. Then that's due to HIPAA. So it'll give you an opportunity to sign in, create a new account, and then when you log in, change preferences, you can give your dependent or your spouse access to view your information and vice versa. And I know later on, if we need to, set up like a Teams call or a Zoom call to maybe walk you guys through how to sign up, we'll be more than happy to do that as well. Like I said, one of the greatest things we've added has been the digital ID card. So where if for some reason your ID card, you've lost it, you can also call MedBen and we'll be able to get you a new one. But also if, like mine's in my wallet, mine's already smeared. I've had mine for 3 months, and it's smearing a little bit just because I keep it in my wallet. with that. But you can always request a new one, and then you can do a digital one there. And then I'll let Mike step in on this here.
Do I know how to work this? Go forward?
Yes.
It's very complicated. I love a live audience, by the way. Thank you for inviting me, June. My name is Mike Scher. I'm with HST. We are the leader in reference-based pricing. I know that's kind of a new term for most of you, but trust me, and you'll have it on video, by the year 2030, you're going to basically be hearing a lot more of it because it's really taking over the way that health insurance is done in the United States. The days of PPOs, HMOs, EPOs, and so forth have really outlived their usefulness. We're not getting the discounts, and the health insurance, as you all know, continue to rise, which is why Dan and Coors made the big decision to be at the forefront of this. It's been around probably about 12 years. It's been slow adoption in Ohio, but it's coming on very, very strong. So, we are owned, this is HST, we are actually a technology company. And the founding name of our company back in 2009 was Health Savings Technology, which, like any other company, we shorten it to an acronym, HST. And we were acquired by a publicly traded company called MultiPlan. MultiPlan's traded on the New York Stock Exchange. They own a lot of PPO networks, national PPO networks that you may or may not have heard of, but one of them is called PHCS, which is the largest rental PPO network, similar to like you were utilizing the United Healthcare network. PHCS is another PPO network. So the way that this program works is you have HST is the repricer, okay? And for any provider, a doctor who's not part of the PHCS network, because you are being given actually a PPO network for physicians and ancillary services. So I don't want this to be kind of a shock to you that you don't have any PPO network, because you will have that on your ID cards, that logo. So if your doctor happens to participate in the PHCS PPO network for value-driven health plans, VDHP, you may see that acronym in the future, VDHP, value-driven health plans, your doctor is contracted just like they would be with UHC right now, okay? If they're not, no worries. We're still gonna reprice those claims just like a United Healthcare would or any other PPO network, and we're gonna pay your provider. There's not a material difference in how much we pay doctors versus whether they participate in a PPO network or they don't. Okay, I'm gonna repeat that again. There's not a material difference in what doctors receive whether they participate in a PPO network or not. So the chance of balanced billing, we keep throwing that word out there, is very, very slim, okay? The goal is to continue seeing your providers, okay? We're not trying to disrupt your doctor relationships, because provider relationships are incredibly important, especially primary care, okay? If your doctor's not in the PPO network, and for any hospital facilities, you know, services that you get, we're gonna reprice those claims as a percentage of Medicare. So you don't need to know this really, but those, if a patient is with Medicare, they're getting what we call 100% of Medicare reimbursement. At HST, we're giving them 140% of Medicare. So it's not like they're getting less than they would if a person wasn't, you know, on Medicare, okay? And of course, that's a lot more than if they're on Medicaid. Medicaid reimbursement to providers is even less than Medicare. So again, there's a lot of pieces here. MultiPlan is our parent company. That's the publicly traded entity. What you're gonna see are these two logos. HST, we're just the technology company that's repricing the claims. PHCS is a physician and ancillary PPO network, okay? So let's see what else we have here. Okay, so we kind of talked about this. You're gonna get, or you already have gotten, you know, probably a PDF of, you know, your employee benefits guide from June and USI Insurance Services. There's a video on here, but are you able to play it? I'm just gonna try to play it. Kind of show you how this works. But again, the important thing is just keep your current relationships, okay? We're gonna give you some tools to look up what the acceptance rates are based on the claims that have already come in. We could tell you the majority of the providers in Ohio readily accept reimbursement without any balance bill. Dan's gonna knows of one or two providers that are a little bit more sensitive. Okay.
It's not showing.
We've partnered with HST to make a value-driven health plan available to you. Our new plan helps you get the most from your healthcare benefits by giving you the tools you need to shop for your healthcare provider. Under your value-driven health plan, you have open access to facilities such as hospitals and surgery centers. For physicians and specialists, you have access to a PPO network for MultiPlan.
There it is.
If you select a provider from the network, your out-of-pocket
Good
costs are
job.
covered
Extra
services.
bonus points for Brian
We've
here.
partnered with
Check his
HST to
resume.
make a value-driven health
Okay.
plan available to you. Our new plan helps you get the most from your healthcare benefits by giving you the tools you need to shop for your healthcare provider. You've driven open access to facilities such as hospitals and surgery centers. For physicians and specialists, you have access to a PPO network for MultiPlan. If you select a provider from the network, your out-of-pocket costs for covered services will be limited to your copay, co-insurance, and/or deductible. You can choose a provider and facility using HST Connect, which is a mobile app and website. HST Connect's data allows you to pick a facility based on cost, quality, and how likely the facility is to accept HST's price for care. Once you choose a facility, HST works to obtain any required pre-certifications. HST also makes sure the facility is informed that you belong to a value-driven health plan. In some cases, your plan may recommend an alternative facility if the provider and plan can't agree on a fair price. Receiving care at one of the alternative facilities will lower your cost, but the final decision of which facility to use is yours. After your treatment, you will receive an explanation of benefits that outlines your share of the costs. If you receive a bill above the patient responsibility listed on your EOB, this is a balance bill. You should contact HST's Patient Advocacy Center right away. HST staff will contact the facility on your behalf and work to resolve the issue so that you don't have to pay more out of your own pocket. Value-driven health plans give you the information you need to choose a provider and keep your out-of-pocket expenses down. To access HST Connect, download the app to your phone or visit hstconnect.com.
Nicely done, thank you. Let's see if we can get back.
How do you get it back?
I guess I should also kind of just overview that everyone should take just like a deep breath. It's like, I'm telling you, this is gonna be fine. I've been in the industry 25 plus years. I actually was an employee benefits advisor for 17 years. Several years with USI, actually, based in Indiana. So I've done this for a living for a long time. I have a lot of experience with this. It's gonna work out fine. Just do your normal routine, okay? Let's see if we can flip back through this. Okay, there we go. Okay, so again, you're going to be able to go wherever you want. That's the nice thing about reference-based pricing. You can go to any doctor, any provider you want. We had a conversation earlier, prior to the meeting, about certain facilities, and if you paid any attention to the video, some facilities, meaning hospitals, some more readily accept the reimbursement. Others push back a little bit. They want a little bit more money, and those things happen, and we can negotiate. What's important to know as a patient, okay, a client of your provider is you do have a certain say as far as where you go and seek treatment. So you can go to hospital A, B, C, you have alternatives. A lot of times it depends on geography. You want something that's convenient to where you live or where you work. Just note that if on a pre-certification, if you're having a surgical procedure, an inpatient procedure, I just had a heart procedure about a week ago, and my doctor wanted me to do it in a downtown facility in Indianapolis, and I said, no way. I'm not driving 45 minutes to go. I want to have it near where I live. So they just redid it, because the doctors typically have multiple admitting privileges. So just note that you have the power to have that conversation, okay? So HST Connect, when you get your new ID cards and you can download this, I strongly encourage you to download this. I use the mobile app all the time. Some people they prefer to use a laptop, desktop computer, and you could do that. But there's a lot of information. You can see my glamour shot here. That is me on my mobile app. I wish I still looked like that. But there's a lot of information out there. I'm going to go through a little bit of it. But the bottom line is you're going to be able to, get the information you need as far as what doctors and hospitals readily accept HST's reimbursement, where you don't have to worry so much about the potential of the bounce bill. Yes, ma'am.
For ones that are not listed, like, my doctor, I don't think my doctor's on there. I checked on the pre-information. So they're not on there.
They're not part of the PHCS Value-Driven
Right.
Health Plans
But
physician network.
Is there like a way to go, okay, this is how much I will have to, like, is there a
Not to that extent.
Like an estimator, like a
No.
cost estimator?
They're only not for doctor visits. There is a cost estimate. So I had back about a year ago, I had spinal fusion, which is why I use this. Our app is NSA compliant, the No Surprises Act. I don't want to get too technical here, but what we have is you can tap on any part of the body over here and it'll bring up any number of procedures. I'm talking surgical procedures, inpatient, not a doctor's office visit. And they will give you ranges of pricing at the various facilities that you can choose from, okay? But it's not a specific, here's what it is. And it does go, there's a part here where it can say, how much of it is your deductible, how much of it is your coinsurance and so forth. But for doctors, I'm telling you, if your doctor's not part of PHCS, please don't worry about it. Do not look to change your doctor. Just continue to seek your doctors, whether they're primary care or specialists, okay?
And then my other question is,
Sure.
what about, like, I had an emergency situation back in September, and, they take you to the local hospital.
Sure.
And so you don't have time to have that pre-planned or pre-approved.
Yep.
So don't worry about it.
Don't worry about it. Don't worry about it. I don't know if anyone drinks, but don't worry about it. Yes.
I guess I'm currently pregnant.
Congratulations.
Thank you. So that was just my fear of, because I'm seeing a OB but also a specialist, so.
Continue to see
Okay.
your doctors and
Okay.
stop worrying about it.
Okay.
It's not good for the baby. Now, maternity, we really don't have, I would say balance bill issues.
Okay.
It's just it's kind of a package deal. It's, you may have a lot of different doctors and other services, but it's usually kind of one package deal. Here's what the maternity, a vaginal delivery versus, what's the other one?
C-section.
Both of my kids were C-sections. Truthfully, both of my kids were C-sections, so don't worry about it, okay? So there's a lot of information on our mobile app and our website. You're not going to use it all. You don't really need to, but it's there. So for those that want more detailed information, it's out there. The big thing that we have, and what most people utilize the mobile app, like myself and other consumers of healthcare, where they want to know if they're having an inpatient procedure or some kind of expensive surgical procedure, even if it's outpatient, they can go to our app and it's going to give you a traffic light indicator, okay? And it's really simple. I'm a very visual guy, so we all know green is good, yellow is okay, red. Try to avoid, in this case, blue is a facility that we just don't have enough utilization at, so we don't know what their acceptance rates are. But here's one, so here's Kettering and Troy that I pulled up. This was literally on my app, and I did a screenshot and sent it to June for the presentation. So this is what you saw. They weren't given any quality ratings. A lot of times we integrate with CMS, the Centers for Medicare and Medicaid, and they give hospitals a star rating. 1 star, up to 5 stars. They do not rate children's hospitals for obvious reasons, but in this case there was no quality rating for Kettering, but the key is here, they had green. We're always going to tell you the VDHP acceptance rate, percentage-wise, and with a color code. And I'll tell you why that is in a second. So 99% acceptance rates. We will never show 100% unless it's a contracted facility. And we do have some contracted facilities in other states. So if you're traveling, you have to go to, like we have Cancer Treatment Centers of America. we have what we call a global contract, so there is no balance billing at Cancer Treatment Centers of America around the country. So, but specific to Ohio, the acceptance rates are very, very high, so we don't have any direct contracts. But we're never going to put 100%, because even if we've never had a balance bill, we don't want you to go in thinking it's 100%. You're the first one that gets the $5 balance bill, okay? But the other thing is green. Try to stick with green facilities or yellow facilities. Try to avoid ones that are red facilities, okay? Why is that? Red facilities are indicated they have either less than a 75% acceptance rate, which really isn't, I mean, if you have an acceptance rate, I was talking about the Christ Hospital in Cincinnati, has about an 83% acceptance rate. That's not good. We don't like that, because that means 17% of the bills that come in will result in a balanced bill. Now, 83% have no issue. So if you were given odds on something important, 83% is pretty good, but when it comes to balanced bills, we don't want to have, we want it above 90%, okay? The other thing that can happen is, and I've seen this before, we have this at a facility in Fort Wayne, Indiana, 99% acceptance rate, red. Now, why would that happen? Because in the rare event of a balanced bill, that provider wants more than 250% of Medicare to settle. So you may say, well, what does that mean in English? Well, like United Healthcare, generally speaking, their networks are going to pay more than 250% of Medicare. So you're going to save money with our program. Coors is going to save money with our program. That's the whole intent of this. But at the end of the day, we try to avoid where we're going to pay those higher reimbursements. It's just, I hate to say throwing out money, but you know, you can save money yourself and you can save the organization money, okay? We have, again, in the rare event you do get a balanced bill, deep breath, it's gonna all work out. We have an in-house concierge unit called the Patient Advocacy Center, the PAC, okay? You can contact them by phone, you could contact them by email, pac@hstechnology.com, or through the mobile app. If you have a balance bill and you use the mobile app like I do, literally, through the mobile app, it takes a picture and it sends it directly there. You don't even have to push send. It actually sends the picture and so forth. There's all the Q&A, the FAQs here on this, but you're going to be assigned a patient advocate. So this person will contact the provider, explain how we came up with our reimbursement, and generally speaking, we have less than 1% balance bill rates around the country. Now, you don't care, because if you're that 1%, you're not going to be thrilled, right? But our patient advocates will go to the provider, explain how we priced the reimbursement, and 30% of the time, they wind up saying, oh, now we understand and we accept it, and they write off the rest. 20% of the time, they actually want a little bit more reimbursement. And our patient advocates will go, and we have thresholds that we can do to resolve that balance bill. If they want some kind of egregious reimbursement, then we have to contact USI, contact Dan, and then we figure out, where we want to negotiate. Since the founding of our company in 2009, we've never had litigation. We've never gone to court. It always gets resolved. And I'll tell you something else that's really important. Providers, forget about reference-based pricing. Say you're still with Anthem or Medical Mutual or United Healthcare, and somebody doesn't pay their deductible, they don't pay their coinsurance. What does that provider do? They send you to what? Collections. That's what everyone's worried about. You know what the PPO, the company, United Healthcare, Anthem, Medical Mutual get? 20 cents on the dollar. Nobody wants things going to collection. The other thing I'll remind everyone is, if you've ever had a bill due for your current deductible or out-of-pocket coinsurance with United Healthcare, it'll say, here's your bill, right? Due now, paid now, whatever. If you don't pay that because you're busy, you get another one in 30 days, and it'll say past due 30 days. Another one, past due 60 days, past due 90. After 120 days, that's when they say final note, we're going to send to collections. These are automated systems. This is not the doctor saying, I'm pissed, you didn't pay your your deductible balance. Note that all of these things are automated. So try to take the emotion out of this. Okay, these are automated systems. If you have a balance bill and you think it's more than your traditional deductible or co-insurance responsibility, that's when you contact the Patient Advocacy Center. If you're not sure who to contact, you could contact MedBen. They're your third-party administrator. They're the ones that are actually paying the claims. We're the repricer. And I know that's a little confusing. You don't do this for a living. But we do have these patient advocates. They will be assigned. The other thing to note is your patient advocate will own that balance bill from the moment you send it in until it is resolved. If you give them your email address or your cell phone number, you'll get weekly updates. Here's where we're, so you're not left to wonder, was that thing ever resolved? Like, where is it? You will be kept in the loop. Okay? Question.
So in the past, I've had a situation where we went to the doctor, my daughter has a co-insurance that's supposed to cover a certain amount of things, so I don't pay it because the co-insurance is. And then for some reason, whatever, they didn't, because I have to do an explanation of benefits every single time it happens. But for some reason, they wouldn't pay it. So then the next time we went to the doctor's office would refuse to see her, like say it's 30 days, because of that previous balance, even though I've already explained all of this. Do you foresee that happening with, like, if you get a balance bill and we're owing that money and it says do not pay, is there a time frame or any of that to where that could happen?
Thank you for that example. I appreciate you sharing that. So what I'll say is, again, nationally we have less than a 1% balance bill rate. Another statistic is over 90% of our balance bills, which are a small number, are resolved within 45 days. Okay? The reason that more of them, that only 90% are resolved in 45 days, is because the lack of responsiveness of the providers getting back to us. Our patient advocates immediately reach out. There is no delay. As soon as you send in that balance bill, within 48 hours, they are reaching out, and they have contacts at all the providers. The other thing to note about what's so special about HST, now I'm self-promoting here, because we have competitors. We probably have a dozen competitors. We're a newer industry. There's going to be consolidation. But you got to remember that our parent company, let me see if I can go back to this a second here, because this is important. So our parent company is MultiPlan. It's a publicly traded company. We're the only reference-based pricing company that's owned by a publicly traded company on the New York Stock Exchange. Every other one is privately held by a private equity group, which is trying to monetize the system and make money and then sell within probably 4 or 5 years. Importantly, our sister company, you can see, PHCS, over 98% of all providers in the whole country participate in one or more PHCS PPO network. Now, why is that important to note? Okay, and I know I'm getting a little technical here, is because the last thing we want to do is piss off the provider community, because then the providers will drop out of our PHCS networks. So we have what we call a very collaborative model with the providers. Our competitors in the reference-based pricing industry have an adversarial. They're trying to, punch them down, make them take less money. That is not our intent. We're looking for a reasonable reimbursement. If Medicare pays 100% of Medicare, and we're paying 140% of Medicare, they're being given a fair profit as opposed to an egregious profit, okay? And this is holistically, I want you to understand, because you have to be consumers of healthcare. If you went to buy a big screen TV or a car, wouldn't you go and check out a number of different places online and so forth? You gotta be that way with healthcare, because, I don't know, healthcare keeps, the cost keeps going up, okay? And we have great healthcare, so there's good reason for that. And over 80% of utilization for the people in this room is going to be pharmacy. And what did June say earlier about pharmacy? It's not changing. So there's only a smaller percentage of people that are actually ever going to be affected by even reference-based pricing, because the doctor part of it is a non-issue. It really is. It's when you go and have a procedure, an outpatient surgical procedure or inpatient, okay? But we have a collaborative model with the provider community. We're not looking to screw anyone. I know that's kind of a bad word. We're looking to collaborate and give them what we call fair reimbursement, okay? So, I want to make sure I answered your question. So when it comes to the balance bills again, okay, you're saying that you received an EOB. I would never pay a provider based on an explanation of benefits. I would wait to receive the actual balance bill from the provider. That's just me. I want to see that they took off whatever, whatever the reimbursement and the discount or the write-off or whatever, however they label it. If you get a balance bill from your provider that is more than what you owe on your health plan with CORS, your deductible and your co-insurance, then you need to, contact either the Patient Advocacy Center or MedBen, and then they'll work back through, HST. But you do need to pay what you owe.
Yeah.
So we can't control, if you didn't pay your deductible and you didn't pay your owed co-insurance, and the provider says, we're no longer seeing you until you pay this, they can do that, okay? It is extraordinarily rare for them to cut off, treatment if a balance bill is in negotiation, okay? So if we're in negotiation, you get a balance bill and you have, let's say, God forbid, you have cancer, and you're going in for oncology visits and so forth, and we're negotiating, the facility, the hospital, the doctor, they all know that this is ongoing, that it's in a collaborative state, so you shouldn't have an access to care issue, okay? I can never guarantee because we don't control the actual providers, but it would be a very, very rare circumstance that they cut off care.
And this was a
A
two
co-insurance.
insurances, where one refused to pay it and then the other one
That's a
refused to pay it.
coordination of benefits. That's a
Oh,
different
okay,
animal.
that's what it's called.
It's not co-insurance. Now you're talking
That's-
coordination of benefits. COB is a very different thing when somebody has coverage or
How
think
will
they
that-
have coverage from two different parents or their own company, and then that's a whole different animal. That's when you go to
Oh,
USI.
that's
Birthday.
That's when
That's
June
a
comes
whole
in.
different-
It is very
That's
rare.
what I
Like
was.
it used to be.
Yes, that's a very rare circumstance because the price of health insurance has gotten so expensive. Very, very few Americans are covered by two health insurances. Very, very few. It happens like if somebody works for a union where they're paying 100% for the family, but then you work at your company and your company's paying 100% for employee only, you may have two coverages, but it would be very, very rare. Okay? Well, that's not me, but I want to, before I turn it back over to June, I probably took more than my time, and I
No,
apologize
you're
for
fine.
that, but I want to be, diligent and really specific. If you have questions, there's other people in this room that probably have the same question, so step up, ask the question, so everyone can hear it and benefit from it. If it is something personal, I'm going to be staying around here as well, can help you through it, but all I can tell you is this program works great. It's not perfect, but it's going to save you and your organization a lot of money, okay? And again, my name is Mike, and I'm with HST, and I'm going to stick around for part of the day here, and June knows how to get in touch with me. I have my card here if you need a card, but I want you to just know this is going to work out okay, okay?
Any questions, anything that well, there's still more, but I didn't know before we move on.
Just one quick question.
Sure.
If you get an EOB and then you get a larger bill, and you turn it in to the patient advocate, do you recommend that the employee pay the amount that's due on the EOB, so at least that portion is paid?
No.
Don't pay it at all?
No. I would recommend that you pay what you actually owe based on, well, they're going to get to your actual health plan. So if you owe $1,000 because that's your deductible, you need to pay that $1,000. If it's more than that, and they say you owe $1,400, but you know that your total exposure is only $1,000, that's when you pay your $1,000.
That was my question, actually.
Yes,
I
pay
mean,
what
I
you
mean,
owe.
okay.
Good question, Dan, and I'm glad you clarified that. See, that's the kind of question that's really important that people need to ask. You are still responsible for your plan that, USI, MedBen, and CORS, jointly put together. So your deductible, your co-insurance, you are responsible for that. We're talking about balance bills of above what you owe based on your health plan, okay? And if you're ever in doubt, all you have to do is contact us, contact MedBen, contact USI. Just don't pay something if you're not sure that you owe it.
Yeah.
Because getting it back is an act of God. You ultimately do get it back if you paid erroneously more than you should have, but it's very, very difficult, very time consuming to get it back. So don't pay more than you absolutely are sure that you owe. Okay? Good question. Any other questions? I see some. Okay?
I think you're gonna say something.
Again, I'm going to tell you, if your doctor's not in the PHCS PPO network for value-driven health plans, that's just a doctor-only network, don't worry about it. Okay? Don't worry about it. Okay? All right. Thank you. Again, I'm going to move to the side here as she finishes the presentation.
Thank you. Even with our plans, the other thing that is not changing is that you still have preventative covered at 100%. So remember, when you go to your doctor, you're going for your annual checkup. You tell them you're there for your well visit, it's covered at 100%. If they do something above and beyond in that well visit, you may have to pay for that. So just keep that in mind. So with this plan, that's still the same thing, that doesn't change. The other
I hate to interrupt, this is where my background as an advisor comes in. That's a really big deal that she just talked about. If you go in for a well visit, if they do anything that's acute care, and acute care is what they call sick care, they can change the coding. It's all about how the provider codes it to an acute care visit, and then it's going to be subject to deductible and co-insurance. So if you do anything wellness, do not deal with any acute care issues in that wellness visit, because wellness is coded as wellness preventative, and by law, okay, the Affordable Care Act, it's covered at 100%. Once you talk about, oh yeah, I have this cough and let's do a strep test, then all of a sudden that whole visit, they can't code part of the visit as wellness and part of the visit as acute care.
Yeah,
Okay.
and watch that. Now watch that when you get that EOB, because that actually happened to me. I actually went for my well visit. She asked me how my blood pressure was. I said, fine, and she coded it as a blood pressure visit instead of my well check. But me, knowing what I'm seeing, I knew that was wrong and had them reprocess that claim.
And I'm going to add to
So-
that, because I've had the same thing happen to me with blood work. I'll go in and get my routine blood work ahead of time, you know, a CBC panel, lipid panel, all that kind of stuff, which is expensive unless it's covered at 100% due to a wellness visit. And so I had that, and then I like to have it where my doctor has it for that visit, versus a lot of people do it the opposite. They have their wellness visit with their primary care or whomever their doctor is, then they write out the lab order, send it into LabCorp or Quest Diagnostics or whatever, and then you don't have a chance to review it with your provider.
So would
Okay.
you tell the lab, because I have that coming up, would you tell the lab while you're there, like, this is for my wellness? How do
Yeah.
how do
You
do
can,
that?
it should be coded that way, because the only way to get that lab is through your doctor. So when you call to make your routine, you know, annual checkup, whatever it is with your doctor, and you say, hey, I'd like to get my labs done beforehand, please make sure it's coded as a wellness lab,
And I
because they're
always tell
coded.
them as well, when I
Yes.
go in for mine, I always say that I'm here for my wellness labs.
Now,
And so,
well, keep in mind, the provider is the one that codes it, not LabCorp, not Quest, or wherever you're getting your labs. They can't change it. If it came
correct. So
in,
they'll look at notes and things like that, but usually when I go in for my wellness labs the week before, I do exactly that. I say I'm here for my wellness labs. And then they you know, look at the coding and all that. And then by the time I go into my doctor's office the next week, he asks me if you sign on your chart to look at your labs and see. So then I get my explanation of benefits, and I see that, okay, it processed at the routine benefit 100%. There was one time my wife went in for her wellness exam, or wellness labs, but they billed it as diagnostic. And so then we went through the process where we had to contact the doctor, they had to get the notes, submit the notes in, and then they had to recode the claim, resend the claim in. So.
to get it
Reprocessing.
reprocessed.
So
Takes a long
because we
time.
knew.
I've had that happen before.
Because we knew we
Yeah.
got the explanation and said, why would we pay $15 for a lab work when we knew it was recovered at 100%? $15 is not a big deal, but it is. It's the principle of it. So
Again, we're
just
trying to
always-
educate you to be consumers and understand your health plan and not just do whatever. Okay, if you're going in for routine wellness, you want that visit to be paid at 100% because that's the Affordable Care Act mandates that. Same thing with the labs that are part of your routine visit. And I'm going to complicate it one more thing. Personally, I have hypothyroid disease, so I take Synthroid, a pill every day, no big deal. However, the TSH component of the labs is not considered, believe it or not, part of a routine check. So that part of my labs, I would be responsible for deductible and co-insurance, okay?
Okay. The other thing with your plan that we are continuing is that we will still be offering Teladoc, okay? Because we are switching from UMR to the MedBed plan, you will need to re-register after June 1st with Teladoc. It is still a $0 copay also. So that is going to run through 2024, fingers crossed, it's going to extend. But that is still, Teladoc is available to you, and you do have to re-register after June 1st. This is your Magellan. You still have your Magellan and Paid Health. Like I said, nothing's changing there, and I know we're over time, so I kind of want to go through. You all have the Magellan. HSA accounts, because both plans are high deductible health plans, both of them are compatible with an HSA bank account. So please take advantage if you do sign up for an HSA bank account. I know through Park, I think they offer them, that you can do it through Park Bank, National Bank. That can be taken out of your paycheck pre-tax. It goes into an account that can be used for medical, dental, and vision. It does not have to be just for medical, and it can be used for any tax dependent in your household. So you can use the funds for that also. So take advantage of that, because none of us want to pay more taxes than we have to. This year the IRS does set limits, right? That we can contribute so much that's out of not paying tax on. So an individual amount for 2024 is $4,150. For family, it's $8,300 if you're enrolled as a family plan. You have to be enrolled in employee only plus either dependent, spouse, or family in order to take advantage of the family. Please remember, if you're over 55 and older, you can actually contribute an extra $1,000. They call that a catch-up, only if you're not taking Medicare. If you are enrolled in Medicare, you cannot contribute. You can use what you had before, and it does roll over year to year. You don't lose it, right? So that's funds can go in. You can continue to use that. You just can't contribute anymore. Dental, I'm going to go real quick. Dental, vision, staying the same. There's no changes to your plans. There's no changes to your rates. So dental is staying. We have the same 3 plan offerings for dental. And you have the plan offering for IMED. Both Superior Dental and IMED are here. So if you have any questions to ask them, please see them. They are in the lobby. You also have your basic life that's given to you through CORS. You also have the opportunity, if you would like to purchase more insurance, to sign up for voluntary life insurance. That is all going to be on the portal, right, that through them to enroll. If you need to complete an EOI, or if you want to go more, please see Nikki. She will help you with that service. And EOI is an evidence of insurability. So if you go outside of how much you can enroll for, the guarantee issue, you'll need to complete an EOI. So see Nikki for that. I know Dan and Nikki will be downstairs also helping anybody with enrollment right now in the portal. So if you need assistance getting, signed up, please let us know that.
I have a question on that. Life insurance. So on that voluntary life insurance, when you say it's a guaranteed issue, is that for only new hires? What if I've already been with CORS for 3 years and I declined it last year?
Yeah, you have to do an EOI.
You have to do an EOI?
Yeah.
Okay.
Yeah.
And the reason I mention that is it's when you have the opportunity to enroll a spouse, and I think the rule was you had to have the same amount. I think it's a slide before, maybe, or whatever. Yeah, you can purchase up. A lot of times people don't realize that they may not want or need the life insurance, right? Because their CORS is giving you 100%. But you may be married to somebody that has a health condition and they're uninsurable, and that's when you'd want to enroll in that program just to get your spouse coverage, because what does that protect? You, in case they pass. So just FYI, a lot of people just ignore it and say, well, they're giving me you know, whatever it is at Coors for myself. Okay, sorry.
And you can increase, that's okay, that's okay. You can increase by 10,000 for yourself and 5,000 for your spouse during open enrollment. If you go above that, that's when you will need an EOI. You still have long-term disability, that is not changing through the Hartford. And just some key information, you'll be getting, like we said, new ID cards. So that's why we need to get enrollments in, so we can get that process. So you will get the new ID cards. Dental ID cards, if you have any changes to dental, you'll get a new ID card. If not, you will not get a new ID card. You can continue to use your current dental ID card. But like I think what, you know, Mike was saying, download those apps, so you have those apps, and that you can have those ID cards also digitally, that you have them available to you.
And I'll also add, even if you have a hard ID card, and I tell my, I have 2 kids that are living in different states, I say, just take a freaking picture of the front and back of your ID card and put it in a folder in your, you know, your picture folder. Okay, so you always have your, same thing if you have a AAA card, it's a good idea to, so you're not carrying around, like, this is my wallet. Does anyone watch Seinfeld? This is an episode George Costanza has a wallet like this, and I used to be that way. Now I just have pictures of anything that I need, and with your ID cards, your medical, dental, you know, whatever, take a picture of it and know where that you store it in your phone.
This is just that we talked about earlier. Just remember, anything up to like ending midnight, May 31st, it's all UMR. So if you saw a doctor back in April, you saw somebody in March, that claim will be processed through UMR. Anything after June 1st will be processed through MedBen.
I have a quick question. Some of my stuff from last fall is still, we're still dealing with some of that stuff. After June 1st, will I have access to look at
Yes.
that stuff?
Yes. Cool. They did say up to a year.
Up
Did
to a
look
year.
into that.
I printed off pretty much everything I need, but just wanted to be sure.
And if not, if you don't get access to it, let Millie know. She can get a hold of me. I can reach out to UMR.
Okay.
Yeah.
And you also want to just, if you're all on HSA plans right now, before you lose that access within, I think as you said, a year for UHC, you want to download a copy of your final tally of how much you've spent and so forth for tax records in the future.
And anything you accrued from January 1st through May 31st with UMR, there will be a report that does go over, and you will get credit for those deductibles and out-of-pocket max for MedBen. It will take some time, so be patient to see those. You're not starting over because you are a calendar year deductible. So as of June 1st, you won't see those deductibles then. It takes about 30 days, even 45 days, if not longer, because we kind of wait through May 31st to get all the claims that got submitted. But you will get credit for anything you've accrued from January 1st to May 31st.
So you said if I've already met my deductible, I'm gonna be fine going into,
You'll get
Right,
that
we'll
in
get a
too.
report over from UMR,
Okay,
and they'll send it
yeah.
over to us, we'll get our system updated. But like I said, we're waiting to that last minute there with that, so right away, like, you may not see, so don't stress out, don't, you know. And if you have questions, like I said, call MedBen, call us, we are here to help in any way possible.
And that is a really important point. Deductibles and out-of-pocket maximums are on a calendar year basis. So to June's point, Brian's point, if you've satisfied anything with UMR from January 1st through May 31st, you will eventually get that accumulation towards your MedBen, okay, for the rest of 2024. Okay, you're not gonna have to start a new deductible and then out-of-pocket.
We have available to you through USI the Benefit Resource Center. So you have a lot of avenues that you can ask questions. If it's for dental, vision, whatever, contact BRC, contact the carriers directly. For medical, you can reach out to MedBen directly. If it has something to do with the balance billing, reach out to that PAC or MedBen. So you have 2 avenues just in case if you do get a balance bill. MedBen will gather the information, get that over to HST. HST will begin working on it. Or you can contact HST and the PAC directly. And this is, everything is in your benefit guide. Any other questions, anything? Yes?
Just to make sure, I'm taking my daughter actually May 29th to a new doctor that we've not seen before. So it's still gonna go through UMR, is all gonna be.
That would be
okay.
UMR.
And that's what you said, I just wanted to make sure, because if not, it's annoying.
Yes, it would be
And I'm like,
UMR.
it's pretty close to the end of the month. I don't want any hiccups.
Good question, that will be UMR. Anything else? We're here if you need to ask any more questions.